Assalamu alaikum, welcome to Pediatric Case Review. Today we will discuss the clinical manifestations and the diagnosis of systemic lupus erythematosus among pediatric patients. Let's begin. We will start with clinical case scenario. Then we will continue with questions and answers. So our case today, a 14-year-old Hispanic female presented to the pediatric clinic with a 3-month history of persistent low-grade fever. Also, she has unexplained weight loss and increasing fatigue. She also reported experiencing joint pains, particularly in her wrists and knees, which were more pronounced in the morning. Over the last month, she developed a noticeable rash on her cheeks and nose, which worsened with sun exposure. No significant past medical or surgical history, and no allergies and immunizations are up to date. Regarding family history, her mother has rheumatoid arthritis. Upon doing vital examinations, she has normal vital signs, temperature, heart rate, blood pressure, but general appearance shows she is tired with noticeable weight loss. Skin shows rash across the cheeks and the bridge of the nose, sparing the nasolabial fold. Musculoskeletal examination shows tender, swollen joints in both wrists and knees. Other examinations are normal. Lab investigation shows mild anemia, lymphopenia in CBC, proteinuria and hematuria in urine analysis, positive ANA and anti-double-stranded DNA antibodies, also low 3 and C4 levels. So our assessment in this patient, the clinical presentation along with lab findings is highly suggestive of a childhood onset systemic lupus erythematosus. The symptoms of persistent fever, weight loss, fatigue, arthritis, characteristic malar rash, and lab findings align with classic presentation of systemic lupus. Question number 1. What mucocutaneous manifestation is characteristic of a childhood onset systemic lupus erythematosus? A. Pustular rash. B. Malar rash. C. Psoriatic plaques. D. Fetal-like. The correct answer is B. The malar rash or butterfly rash is a classic mucocutaneous manifestation of systemic lupus. It typically presents as flat or raised erythematous rash over the cheeks and nasal bridge, sparing the nasolabial folds. This feature present in the case scenario is highly indicative of systemic lupus. Also, it is often exacerbated by ultraviolet light exposure.